Hi, and welcome to If Left Unchecked. I'm your host, Jason Gillette. Today, we have a very fascinating topic that I think all of us as fellas will really dive into and really relate to. I have the opportunity to interview a friend of mine who's also an amazing physician at Mayo Clinic, Dr. Nathan Delafield. And we're going to be talking about the idea or the narrative around why men don't get help, why we're not taking care of ourselves, we're not going to the doctor, we're not getting therapy, and there's this narrative that we're stubborn or we're just, we're not as interested in our health care as others are. And so I wanted to kind of check that out and really get an understanding of, is that true? I think personally, I see some truth to it. And personally, I think that there's some growth that I've made in my own healthcare and seeking out healthcare for myself. But by and large, I think that men like, if it's not broken or if it's not falling off, then why am I going to the doctor? And I don't think that that's serving us anymore. I think that that narrative is old. Our health care, our mental health is important, and we should be just as engaged and interested in our health care as we are anything else in our lives. So fellas, tune in, check us as we talk about this. I have an opportunity to ask some questions, and I've thought about this prior to. And Dr. Delafield, I wanted to say thank you for taking the time to join us this
Thank you for having me.
podcast. And then also, you've been an advocate for community health and health in general for as long as I've known you. And why is that? Is that something that came as a result of your upbringing, or is it something like where is your advocate for health come from? And kind of give us some story about like how you got to where you're at now.
Yeah. First and foremost, Jason, thank you for having me on this podcast. I'm excited to engage with you and with your listeners about this important topic. I'm an internal medicine physician, and I have had a journey getting to this point, a journey personally of being in the foster care system and recognizing that not everyone has access to good health care or to social circumstances that afford them the opportunity for health. And through that journey of growth personally and of course in my education, going to medical school and graduating from residency, and thereafter, I've seen the impact of social circumstances, a lack of social support, a lack of equitable access to healthcare, to finances, and the impact that has had on healthcare outcomes. And that has fascinated me. So both personally and professionally, I've just been very interested throughout my career on how non-healthcare factors influence healthcare outcomes. And so because of my personal journey and my professional interests, I have just been very deeply invested in community health and helping to demystify the reasons that we are sick and to highlight opportunities to improve the health of our community.
Excellent. And see, exactly what I think is so beautiful about us having this conversation, because one of the things that we talk about is, if I'm not like deathly ill, I'm not going to the doctor. We're just going to go ahead and avoid that. And I've learned, and I think we've had conversations where, like, how do we change that to, if I'm feeling some kind of way, I'm not feeling well, what's the difference between someone who goes to the doctor in that instance and someone who doesn't? Why? What stems? What's behind that?
Mm-hmm. Well, a variety of factors I think are at play there. Number one, I want to acknowledge that it can be very difficult to know, especially for someone that may not have healthcare training, but I also see it in doctors that I have the opportunity to care for, knowing when to seek care. Part of that is a function of many people don't have a healthcare team to lean on to ask the question of their doctor or of their healthcare provider, is this something I need to be worried about, or is this something that we can watch? And I can say that there are plenty of my patients that have a very low threshold in asking that question, and I welcome it. So having a team that you can lean on when times are uncertain, when you have questions that arise, is a main opportunity for us to do a little bit better and not have to rely on the internet or ourselves when we're not feeling well. So, I think part of it is building that team around you, such that when questions arise, you can ask the question to others.
Yes. And so you talk about team, which I think is actually a really neat concept because the team doesn't entirely mean just the doctor, the physician, right? So when we talk about team, like what's our team? Like if you have a team, what's your team?
Well, my team is my physician, the nurses that are part of my physician's team. Certainly, as a doctor, it is really important even for me to have a doctor, and to seek out healthcare and not to be my own physician. I may have my own ideas, but when you're not feeling well, all goes out the window. But my team
Right.
also is my family, right? My family, when I'm not feeling well, when they see something going on or changing in me, that I may be able to lean on them. They may not be trained healthcare professionals, but they may help to advise me or push me when I need that nudge. I too can be stubborn in the way that I approach my health during times. My friends who may have had similar experiences, I'll point out specifically that, and you and I have talked about this before, that specifically as it relates to mental health, this is an area that I have found great satisfaction being able to lean on my friends, to talk about, hey, yeah, I've also seen a therapist, and it was greatly helpful and beneficial, and really to break down some of the stigma associated with engaging in conversation around mental health has been really helpful. So I've leaned on my team of friends, men who have gone through similar challenges. On the surface, we're all tough providers, strong professionals, and yet we still are human. And so
Yeah.
hearing the stories of others has also reinforced my personal journey.
I love that. And so that like for me, if I'm developing a team, I need someone who knows me best. I need a professional. I need people who care about me. So it's almost like a community. You're building your own community of care. And I love that because I think about my family and how if I'm not feeling well or if I'm having some issues, and they're always there to remind you, hey, hey, you should get that checked out, right? And you're like, I don't need that. And so for fellas that don't, like we have there's a large population of men. I'm like, I'm not going to. I'm just. It's not. If it's bad news, I don't want to hear it. If it's bad,
Right.
I'll just find out where does that come from, and how do we talk about that, or create space where we can get that conversation from a I don't want to know to maybe I should get this checked out. Whatever the case would be, I know I can. Me and my family, my squad, my health team can figure it out together. How do we get to that space?
I think a lot of that perspective and that reflex of I'd rather not know, or I don't go to the doctor because all they have for me is bad news. It's a story that I've heard time and time again. But ultimately, it's my opinion that that's usually a fear response, right?
Yeah,
a
yeah,
response that I don't want to know. In reality, most people do want to know. They want to know that they're okay. They want to know that there's a
yes,
treatment available if they're not okay. But getting over that hump can be a challenge, because you don't know where to go. How do I get connected? How do I know that the bad news that I may receive won't result in me feeling worse and not better? And so, normalizing that first and foremost, because it's very common, is I think important. The second piece is something that I reiterate to my patients, to my friends, to my family, is that the best medicine is preventative medicine, and the best
Yep.
medicine is getting ahead of problems before they become bigger problems. It is not the case in most healthcare related issues that if you ignore it, it will go away. Often, if you have diabetes and you ignore it, the diabetes will likely only get worse and may have consequences. And if we look at two populations of individuals, one who was proactive despite the diagnosis and got on effective treatment, that may be the difference in years of life. That may be the difference in outcomes, whether it be heart attacks, strokes, or neuropathic disease related to the diabetes. So it's important that we are preventative. Lastly, we should be establishing care relationships with our healthcare team before these problems arise, such that we are aware of small changes in our health, that our healthcare providers are engaging with us in the discussion, and knowing that we're not alone in this journey.
I love that. How do you build a relationship with your healthcare provider? I think that um, that can be difficult, especially if you're like, I really don't have a primary care, or I don't really like see the doctor regularly. How do I build that relationship? And and for some guys, it's like, I'm here for a checkup, man. I'm not trying to learn life stories, but that's so important, right? We need to be able to have that ability to build those relationships. And so, what's one thing is for someone who wants to build a relationship with their healthcare provider, or wants to connect with the healthcare provider, what's one way that we can do that? Like, what's one effective way that you've seen where that relationship between patient and physician worked well and yielded something positive?
Yeah, yeah. I think there's a variety of ways that this can be accomplished. I think that one is getting recommendations from trusted friends, family, and community members around healthcare providers or physicians, nurse practitioners, physician assistants, um, who they have had a really great experience with. In medicine, just like other industries, not all individuals are created equal, and there may be individual preferences based on experience or personality that are important to building that relationship. With that being said, access to healthcare can be quite limited. And so we also have to recognize that in some ways we can't be overly selective because you
Right.
may ultimately delay your care.
Got it.
Starting that initial encounter with your healthcare provider around, getting to know you and really carving out time with that healthcare provider where you may not even address a medical problem, but you get to know them, they get to know you, they understand your values, and vice versa, can be really impactful. And I encourage men and women to seek out healthcare teams that are willing to spare that amount of time where you really feel comfortable, such that the next visit, when you have a headache or a twisted ankle, you feel really comfortable with the guidance being provided. It's very important to have a trusted relationship with your healthcare team, such that you know that the recommendations that are being made for you reflect the values that you have in your life. And that you may be open to the fact that while you may disagree with the treatment, you trust that your best interests are kept in mind when it comes to your healthcare team and provider. Lastly, I'll say if it's not working, and you've tried, you may seek out care elsewhere, and that may be necessary so that you are aligning with care that is more consistent with your values, consistent with your desires, and again, you can lean on your community for that as well, to find it out.
I love that. And so, some of the larger pieces that I think I'm pulling from that, I think they're really valuable. One is making that connection, right? Like, how do we be intentional about making the connection? I think that um, some people may find that challenging, but I think that if the intention is, hey, I want to make sure that my care is consistent,
Hmm.
and that my relationship with you is such that I feel comfortable coming to you and talking to you about things that I would have usually just kind of swept under the rug, like,
Hmm.
again, a twisted ankle, or like my chest is hurting. I don't know if that's a thing or not. And you go about finding your team based on the relationships. And so again, when we talk about finding care elsewhere or finding care, work within your relationship network, your care team, right? So if your family goes to a physician or has a care team that they really like, being able to kind of reference through there or get a referral to that care provider. Or if your friends are like, man, I got a great doctor, man. If you're
Mhm.
looking for somebody who can really, I think that's a part of your care team, because then you're building, your friendship group, your family. Everyone has their own care experiences, and if they have a relationship with you, then how they're referring you out to their care team will, that kind of warm handoff can be very valuable and help that relationship grow. And then another thing that I think is important is being able to ask yourself, how comfortable am I with talking to my healthcare provider? So if I do have a healthcare provider and I'm not very comfortable talking to them, ask
Right.
myself, why? Am I
Right.
like, is it them? Have I made the effort? And so there's a lot of opportunities for us to build in some skills and learning some ways to measure our comfort level with our care team that we can operationalize and put into practice now. And so
100%.
what narrative, like if we had to kind of sum up um, how we as men go through our healthcare journey, if you had to sum up a narrative that we had to challenge and we had to say that's not true anymore, well, what would that be?
I think the narrative that I would challenge is that men don't care about their health. I think that that's untrue. I think most men care very much about their health. There is a societal um, pressure that often is implicated here, and that is that men are providers, that they're strong, that they are resilient, and that may be very true. Um, but there's a bit of a challenge when men who are supposed to be the providers, who are tough and strong and resilient, need care. And
Right.
so men care for themselves. There's probably a significant fear that a health related concern may limit their ability to continue providing and being strong and resilient. Certainly, we need to better support men in their journey of being vulnerable and receiving care and support. And so I think that it is our societal obligation to continue to support everyone, but in particular men who may not actively seek out care because they're so busy caring for others, and address the needs that they have. The old adage is you can't pour from an empty cup. And I think it's really
Yes.
important to know that if you're not well yourself, you can't care for others in the same capacity. And I've seen time and time again hardworking men unable to continue their work because of illness that has been disabling, and was left unchecked. So we have to really importantly address these things become before they become larger.
I love that, and one of and I love how you framed it. There's, it isn't true that we care about our health, and at the same time, I think that the other part that is oftentimes in the forefront is us as providers, right? We will provide, we will protect, we will, be there for our families, and so when we are unable to do that, that I feel some kind of way about that when I'm not strong
Mhm.
enough to take care of my children, or put my daughter to bed. I'm too sleepy, or I'm tired after a long day, or I'm not feeling well. My chest is tight and I'm not quite sure what's going on. And I think one of the things that I struggle with, and I think that I'm getting better at, is that in between point, right, where it's like I know I'm not feeling great, but I'm not feeling like terrible, and I don't know which way it'll go. When do you like? What kind of conversation should you have at those moments? I struggle with personally. It's like, well,
Yeah.
for instance, like my arm hurts, but I don't know if it's a thing. Is it? And is it a? And what are the barriers to that we can move that'll allow us to say, you know what, my wrist hurts. Let me just talk to my doctor and see what it is. Like,
Yeah.
is it finance? Is it accessibility? Because if the doctor's not available for 3 weeks, then maybe my wrist thing is like, I'm not trying to wait 3 weeks for this. So there's a few external factors I think that kind of perpetuate that, or at least exacerbate that issue,
Right.
how do we have that conversation about when it's not, we're in that middle space? What should we be doing? What should we be asking ourselves?
Yeah. It's a great question, and the way that I think about it is that often the reason behind the challenge that may exist with not knowing where to go for your care, or whether or not to raise the alarm that this is an issue that needs to be addressed with your healthcare professional, is one that is multifactorial. And I think individually we all have a responsibility to ourselves to have a mental checklist of where we stand. Like when we're feeling really good and firing on all cylinders, for me, it's when I have good energy. I'm going to the gym regularly. My social, cup is full. I'm also performing well
Yep.
at work, and I'm getting good rest. I feel well. And during other times, I may be stretched way too thin. I'm burning the candle at both ends, and my life is hectic. And so, I think when we don't have a mental checklist of when we feel really well, what's going well for ourselves, things tend to fall apart. So I encourage every person, and every man in particular, to have a mental checklist. Are you going to the gym? Are you eating well? Are you sleeping well? Are you minimizing alcohol and other exposures? Are you managing your stress? How are your relationships doing? Because a lot of those items on that checklist may point you in the direction of what you can address first. It's clear that I've not been sleeping well. That's why I'm feeling anxious. It's clear that I've been doing this or that. The second thing is, have a low threshold to ask the question of your doctor or of your healthcare team if you're concerned about something. There's no such thing as a stupid question. And it's
Yes.
important that if you don't know the answer, to ask the question. It may be very simple, or it may be a matter of a blood test or a physical exam, or just a conversation with somebody to point you in the right direction. Now, I think that underscores the point that we should probably have periodic, regular screening exams that are not because we are feeling unwell, right? So if we see our doctor once or twice a year on a regular basis, that gives us an opportunity to address some of the things that we just are uncertain of. And most
Yep.
likely, we have an opportunity to address most of those things such that they don't become bigger issues in between care or episodes of care. So those are the things that I think about as it relates to, navigating healthcare systems and understanding where we are with our personal health.
I love that. Yeah, that's. I think that's great advice. And having that mental health checklist is important to say when I'm feeling well. And I think that's something that we don't do enough of. Is when I'm feeling well, what's happening in my life when I'm feeling well, right? And being able to note that. And when I'm not feeling well, what's happening in my life when I'm not feeling well? And you'll find that there's some things that we probably could be doing better that are related to our health, but in the same sense, not. Like, again, our social life is, are we clicking with our friends? Are we being able to connect? Are we sleeping well? Are we eating healthy? Are we having, good productive days at work? Are we at least accomplishing things? All those facets impact the way we see and experience our health. So
Yeah.
it's a multifaceted approach. And it all starts with what you said. Do I know the answer to this question or not? And if I don't, who can I go to get the answer?
Hmm.
And if my healthcare team or my health squad, I go there first. And then we can
Right.
go from my health squad, I can talk to my partner. Hey, I'm feeling this. What do you think? Oh, I think you should talk to the doc. Okay. And you see how you can use your health squad to get you to the right answer. So it all starts with what you don't know first. And then from there, engage your health squad. I love that. I love that.
Yeah.
As we wrap this up, I wanted to bring up one valuable point about building our health team that's important. It starts with us. When we talk about our health, we have to understand what we define as healthy, right? When are we feeling good? Do we take the time to note that and be mindful? Hey, I'm feeling good right now. That's an opportunity for us to check in and see what health feels like in a
Hmm.
very real sense. And so, as we build our capacity to engage in our health and really shatter the narrative that we don't care about our health, men, we care about our health. Like, we want to be healthy. We have a responsibility and we have a desire to be healthy. And so, that's not true anymore. We go to the doctor, we have those conversations. We get our regular physicals, we get our exams, we have a healthcare team, we have a health squad that includes friends and family. That's who we are now. And because we care about our health, we don't let things progress without questioning them. We have an
Right.
interest in making sure that we are at our best at all times. That's the new narrative. I love it. And that's
I
what
love
I
it too.
want to be real for us. And so, Dr. Delafield, thank you so much for your time. Thank you for taking the time to share with us your experience and also helping us to build our health team in a way that's both genuine, intentional, and gives us the tools we need to ask the questions and get the answers we need for being better overall. So
Well,
thank you
thank
for your
you.
time. I appreciate you. We don't have this narrative that we don't care about our health or we don't go see the doctor. That's not a thing anymore. Thank you so much for tuning in. Join us next week as we dive into another opportunity to question another narrative, do something different, and be better. Take care of your mind. I'll talk with you soon. Take care.
Thank you.